Hi, this is Dr. Paul Manito, your Asheville, North Carolina chiropractor, and today I have the honor of having Lindsay DeBrule from DeBrule's Auto Sales with me. And so Lindsay, tell me what's going on with you today.
Well, back in February, started having some back issues while I was in Florida. Didn't think a lot about it. Had a boat ride, thought maybe I jarred my back or something. You know, but it's gradually started getting worse. You know, just lower back, neck. It seemed like it went from the neck all the way down.
Right.
You know, and it's progressively got worse up to now. I mean, and that's why I'm here. I started doing some research and stuff.
What have you done so far for your back?
I've done cryotherapy. I've done different chiropractors. One in Florida, another one up here. Physical therapy. Nothing's worked.
Right, and you've had a CT and an MRI?
See, a CT scan and MRI done, and they didn't find any damages, maybe a little inflammation. And it's just, but it seems like I'm getting no help. I'm getting no relief. I'm the one miserable, and everybody says, well, I don't know, it's not a good feeling. It hurts.
And then you heard about the Y-strap?
Heard about the Y-strap, YouTube, you know, and it said decompression, and I think that's what I need, because that's what spine center I needed, but I didn't give me spine. They didn't give me decompression. They put me on an inversion table, but I still hadn't helped.
Okay, all right.
But I'm overpain.
Okay.
I need some help.
All right. Well, we're going to start with a posture check. So I'm going to have you stand here in the mirror. Just step back this way, and then just kind of nod your head backwards and forwards, and then just kind of stand whatever feels normal or neutral, and then just kind of go ahead and stand whatever feels normal. Okay, let me just borrow that. So we're going to take a look at your posture here. So from the back here, you can kind of see his shoulders are forward, and then coming around to the side here, he's got quite a significant forward head posture, so the ear should line up with the seam in the shirt, and you can see it's a good 2 inches forward. All right. Okay, Lindsay, good. So now let's go ahead and lie face down.
Okay.
All right, so now we're going to be doing your leg check. So first I'm going to be checking your leg length. Good, and your leg length looks even. Now we're going to be doing the flexion test. So I'm going to go heel to buttock, and I'm going to be measuring these. Just relax, please. Good. And the left one, I don't know if you can feel it, but the left one goes further easier than the right. The right kind of gets stuck. So this right one is about 2 inches less. Do you feel the tension on that side?
Oh yeah, definitely on the right, lower.
On the right, okay.
Yeah.
The third leg check we're going to do, Lindsay, is without bending your knee, you're going to raise your right leg straight up as high as you can, lower it, and then do the left, and I want to see which one's harder to raise, okay? So try the right. Good. And now the left. Okay. So the right one was way harder. Could you feel that?
Oh yeah.
It only came up about 50% of the left. Okay. So what we're going to be doing is adjusting the right SI joint. You're going to bend this knee, raise this leg. The table's going to drop away. So I'm adjusting along the 3 axes today. This is the Z axis when we go from back to front. Now I'm going to place a block under your SI joint. Table's going to drop. Do you feel it?
Oh
yeah. Breathe in and out. There we go. Feel the movement?
Yeah.
Good. Now take a deep breath in and deep breath out. Okay, now you're going to feel just a little chiseling here on the hip. This is to unlock that joint. Is that tender?
A little bit.
Okay, now we're going to go back to recheck the legs. So we're going to go into flexion. Relax. Good. Feel the difference now?
Mm-hmm.
Actually, now the right's better than the left. Good. Without bending your knee, now raise your right leg as high as you can. Wow, much better. Left. Good. Do they feel even now?
Pretty close.
Good. They measured measured even. All right, so that looks good. So once those leg checks are clear, then we know we're done with that section. You're gonna slide down this way just a little bit. So now we're gonna have you turn your head to the sides and lay it down on each side and see which way feels more difficult.
Going to the right.
Going to the right? Okay, turn to the right, please. Good. Good feel. Good piece is going to drop away here. It's loose. Good. Now back to center. Now let this arm hang. Good. This arm hang. Good. Back to center. All right, so now turn your head to this side, to the left. Now go to the right and see if the right is easier than it was earlier.
Yeah.
Are they even, or is the right still harder?
No, it's still a little harder on the
Right.
on the last inch.
On the last inch, okay.
Yeah.
All right, so back to center. So this is the adjustment for the forward head posture. Slide down just a little bit. Now we're going to go chin up. This is going to bring your head back to your shoulders. Good. And that table's going to drop. This is how we correct the forward head posture. Now you're going to feel a little chiseling here. Tender?
Yeah.
Now take a nice deep breath. As we bring the head back, that opens up the airway. So that should make you breathe a little better. Okay. Now turn your head to the left again. Yeah. Now go to the right and see if that's better.
Yeah.
Yeah. Are they even?
I mean, they're very. I mean, it might be that tad, but
Just a tad.
I would. If I would look
Okay.
for it.
Back to center. So I'm going to just work those muscles there just a little bit. I think what that little bit left is the muscle tension. So we're just getting into these trigger points here in the muscles. I guess you can tell the right side's worse than the left. I don't feel anything on this side. But right in there, yeah, that's pretty. So now you can see why I asked you to drink a lot of water today, because you're going to be sore tomorrow. Okay, Lindsay, can you turn your head now to the left? Good. And now to the right and see if that's better?
Oh, yeah.
Good. Are they even now?
Mhm.
Okay.
Yeah.
I won't stop till they're even. All right. Next, I'll have you turn over on your back, please. I'm like a pit bull when it comes to getting things cleared out. All right, so now we're going to be doing your leg decompression. Now we're going to start working the y-axis. So the other adjustments, we were doing the z-axis.
Okay.
And now this is y-axis, so you're going to feel a little stretch and then just a little thrust. Good. You can slide back up. That actually released before I did the thrust, just when I was tractioning. Good. Now this one, just relax. Good. Definitely got some movement out of the right
I
one.
felt
Did
that
you
one.
feel it
Yeah.
up in there?
Yeah.
Okay, good. Good. You're doing really well so far.
Yeah.
So the next one, we're going to sit up and just spread your legs there for me. Now we're going to be doing the x-axis, which is going to be rotation. Okay. So cross your arms on your shoulders here. Good. Let's drop them down just a little bit. Good, and then take a deep breath in and deep breath out. Twist to the right hard, twist. Good. Now we're going to do the other side. Now twist to the left, twist, twist. There we go. It's tight in there, can you tell? Yeah, it's so compressed in there, it doesn't want to move on the x-axis. So now we're going to be doing the y-axis here in just a minute. Have a seat right here. All right, good. So I'm going to have you lie down on your back. Good, just like so. And let the hands rest here. Good. All right, so now the Y strap. Okay, so you're going to feel a few little stretches, like so, and then you'll feel the thrust, okay? So I'm just kind of stretching it out just a little. Good. All right, now take a deep breath in, deep breath out. Good, you're going to feel the stretch, and then a release, good. All right. Well, what did you feel today, Lindsay?
All the way down the middle.
All the way down to the lower back?
Yeah.
So it went from head to tail?
Yeah.
Good, so just lie there and rest a second.
Right down the center.
Take a deep breath. You'll probably notice the breathing's going to be better because that opens up the airway.
Yeah. That's crazy.
Is that not something else?
Yeah, definitely.
All right. Good. Now we're going to sit up. And then we're going to come on back into this room and we're going to be doing some lumbar decompression.
Okay.
All right. Okay, now we're going to be doing your lumbar decompression. So you're going to feel it's a little stretch right here. So here we're opening up the disc space, decompressing the vertebra, the disc, and the nerve. Okay, so you're starting to feel that decompress?
Mm-hmm.
Is that too much pressure there?
Yep.
Okay. So that's kind of where, feel the heel of my hand?
Yep.
That's where it is.
Yep.
You can tell?
Yep.
All right. So this is decompressing the disc. It's also pumping fluid into the disc, blood and nutrients into the disc, which is going to help slow the degenerative process. And then, again, that's where the water comes in. Really important to hydrate the discs. And then we're just going to go a little flexion to the side here. And a little flexion to the side here. Tender?
Yep.
It's swollen too, so I'm going to have you use some ice on there later.
Okay, yeah. I got plenty of them things.
Okay, good. Okay, so that was the lumbar decompression. To get up properly, I'm going to have you roll to your side and face me. This is how you want to get out of bed, and then bring your knees up and then sit up.
Yeah, but I will have to do that down from elbow because
Right.
you learn to adapt to get out of bed.
Absolutely.
Yeah.
All right, let's come on back inside here. Okay. So now we're going to recheck your posture and
Okay.
compare it to your first turn around and face the mirror. Good. Step to the center there. All right. So let's take a look here. We're going to take a look from the back. All right. So we can kind of see the shoulders look better. Look at the arms, Lindsay. Can you see your arms are hanging even now?
Mm-hmm.
Remember that right one? Remember the spacing was greater?
Yeah.
All right. And then let's take a look from the side. Okay. And you can see his head's come back quite a bit. It's come back a good ½ inch. All right. So turn and face that way. I want you just to take a look. Hold this mirror in your right hand now. Now take a look at where your head is. Keep your head, we just move the mirror, don't move your head.
Oh yeah.
Do you see here? Try to keep your head here. Move the. Yeah, just angle this mirror so you can see yourself in that mirror. Okay, so you see the center of the ear and the center of the shoulder.
Oh,
So
yeah.
you can see it's come back
Yeah.
about a half inch.
Mhm.
All right, very good. Okay, so that was a demonstration of the Y strap and also the lumbar decompression. What did you think?
Felt great. Definitely felt it, especially with the Y strap
Right, you could feel it all the way down.
right down the middle.
Right.
And got down into that.
Right,
Where
so
it
you
really-
feel like we targeted
Yeah,
the
definitely,
problem
yeah.
better than the other treatments that you've been having?
Oh yeah, I got more. I mean, you know, we went to different areas. Normally, it's just like don't get too much involved in it, but yeah,
Right.
big difference,
Right.
totally different.
Okay, great.
Yeah,
Great. All right.
definitely.
So thanks for watching. Leave your comments and questions. Be sure to subscribe to our channel and check out our website, MagnetoChiro.com.